If a doctor suspects that someone has torn their quadriceps tendon, these are the signs and symptoms that they'll start by looking for. First, most patients will describe a sudden popping noise at the time of the injury. The majority of patients are unable to walk immediately following the event and will be unable to actively extend the knee. This is because the tendon which connects the quadriceps muscle to the knee joint is no longer there. So the quadriceps muscle is no longer connected to the knee joint, and since the quadriceps muscles are responsible for knee extension of the knee can no longer occur. Obviously, patients with a torn quadriceps tendon have significantly less stability at the knee joint. Acute knee pain, swelling, and bruising are all common symptoms, and there will be a palpable gap where the tendon was torn. As for the quadriceps muscle itself, sensitivity and cramping can occur. It is common for the patella to drop a bit as it no longer has the tendon to pull it superiorly, but this can be hard to see due to the swelling. Because quadriceps tendon tears are so rare, they are often misdiagnosed, with doctors more likely assuming injuries including a patellar tendon rupture or a stress fracture of the patella or femoral shaft. To make matters even more complicated, diagnosing the injury becomes more difficult the longer the injured person waits to see a doctor, as the symptoms subside to resemble more closely the injuries listed above. The most important part of the examination is testing the patient's ability to do a straight leg raise. If they can do it, even partially, a quadriceps tendon rupture can be ruled out. However, if they cannot do a straight leg raise, have difficulty climbing stairs, and walk with knee stiffness and an elevated hip on the injured side, the quadriceps tendon tear is likely. During these tests, it is important to compare the injured leg to the other to rule out a bilateral tear. In regards to a neurological examination, the patient will lack the patellar reflex. X-rays may be performed to rule out other injuries, but imaging is not common with quadriceps tendon tears. However, ultrasounds can be used in order to determine the size of the tendon gap, which is helpful in establishing the treatment plan.
Created using Powtoon.